You are listening to a pre-recorded webinar for the series UDS 2021 Reporting Success. This presentation is a review of the setup areas in energy practice management and EHR that impact UDS reporting. The key UDS setup areas in energy PM are found in the UDS Report Maintenance, Procedure Code Maintenance, and the Poverty Guideline Maintenance. The UDS Report Maintenance window in Intergy is a central location for maintaining and viewing the configurations used to produce the UDS reports in the Practice Analytics UDS dashboard. This window consists of the staff, insurance, race, ethnicity, grant reports, and other pages. In the upcoming slides, I will explain how each page affects the UDS report and provide the recommended setup. From the UDS Report Maintenance staff page, you can assign or edit the UDS staffing category associated with each provider, as well as set which providers are excluded from the UDS report. You do not need to exclude providers whom you have deactivated in prior years, as the UDS dashboard reports will count only those encounters that occurred during the reporting period. The category assigned to each provider determines which line on this Table 5 Staffing and Utilization Report that the provider's encounters will be counted to. Any provider not assigned a UDS staffing category will show in a warning as you enter the UDS dashboard, and their encounters will not contribute towards your UDS numbers. From the UDS Report Maintenance window, you can quickly view all the providers who are unassigned a UDS staffing category by unchecking the Include Staff with Translation box up at the top of the setup area. From the UDS Report Maintenance Insurance page, you can edit how insurance plans are translated and categorized in the zip code, Table 4, and Table 9D reports. The assignment given to the payment source field for the plan determines where the patient will be counted on the zip code and Table 4 reports, if that plan was the patient's primary medical insurance at the time of their last visit. When a plan is excluded from Table 4, all encounters where the plan is primary will be excluded from Table 4 counts and from other encounter-based tables. However, this restriction does not include Table 9D. The assignment given to the payer category field determines the line in Table 9D for which the charge amounts will be counted. You can exclude responsible amounts for a plan by selecting Exclude from Table 9D. Make sure to map your Medicaid, Medicare, CHIP, and special contract plans, as well as uninsured safety net programs to their appropriate payer categories based on UDS criteria. Any plans not mapped will report to the private insurance category. From the UDS Report Maintenance race page, you can assign or edit the UDS report categories for each race. Any non-standard race code added to Intergy must be mapped to a UDS race code, or the patient will be counted to unknown on Table 3B and Table 7 for race. From the UDS Report Maintenance ethnicity page, you can edit the UDS report categories for each ethnicity. Any non-standard ethnicity code added to Intergy must be mapped to one of the UDS ethnicity codes, or the patient will be counted to unknown on Table 3B and Table 7 for ethnicity. From the UDS Report Maintenance Grants Reports page, you can edit the patient statuses that identify patients who can be reported for specific grants. Worker statuses are used to identify patients for the Migrant Health Grant Report. Homeless statuses are used to identify patients for the Healthcare for Homeless Grant Report. The setup on the Grants Report page should include all the worker statuses and homeless statuses shown on this slide. From the UDS Report Maintenance Other page, you can edit a variety of elements. You can change how homeless are displayed when the homeless status field in patient information special population is blank. You can specify which service centers are considered school-based health centers on Table 4, line 24. The window also allows you to edit bad debt adjustment codes which are used to calculate Table 9D, Column F. In the section Table 9D, Insurance Adjustment Codes, enter the adjustment codes used to identify insurance adjustments so that they can remain in the insurance payer categories instead of self-pay. In the Procedure Code Maintenance window, you can add, edit, delete, deactivate, or reactivate procedure codes. The only element in the procedure code setup used for UDS reporting is the UDS qualifying visit checkbox. Procedure codes representing services provided by physicians or other qualified healthcare professionals that meet the E&M guidelines should be checked. Codes for ancillary services that are done as part of the visit or lab or admin codes or CPT2 codes should not be checked. The Poverty Guideline Maintenance window displays the poverty guidelines which specify the poverty level income dollar amounts for family or household units based on the federal annual poverty guidelines. The poverty guidelines are used with the patient's income amount plus supported household to determine the patient's poverty level and where they fall on Table 4, lines 1 through 5. The key UDS setup areas in Intergy EHR are on the immunization schedule and vaccine codes in the immunization setup, and a LOINC cross-reference mapping in labs information. The immunization setup utility is where you can define and maintain your immunization schedules and vaccine codes for your health center. The UDS reports that use these clinical data elements are Table 6A, Selected Diagnoses and Services Rendered, on lines 24, 24A, and 24B, and Table 6B10, Childhood Immunization Status. Displayed on this slide is an example of a pediatric schedule that includes the 10 vaccines the childhood immunization measure qualifies. They are 4 doses of DTaP, 3 doses of IPV, 1 dose of MMR, 3 or 4 doses of Hib, 3 doses of Hep B, 1 dose of varicella, 4 doses of PCV, 1 dose of Hep A, 2 or 3 doses of rotavirus, and 2 doses of influenza. Ensuring that your pediatric schedule includes these vaccines is the first step towards improving measure compliance. Added to UDS 2021 reporting is data collection of the number of patients and visits where the COVID-19 vaccination was given. Line 24B was added to Table 6A. On this slide is an example of an immunization schedule setup with the COVID vaccines. Greenway suggests using a combination or interval schedule for the COVID vaccines and have a reference guide available that provide instructions for setup in Intergy. Please reach out to the HCN application support team if assistance on setup is needed. The way the UDS report identifies the qualifying vaccine was administered or documented is by validating on the CVX code assigned to the vaccine setup in Intergy EHR. In the Edit Vaccine window, the CVX code field should not be blank but populated with the correct code. Please reference the CDC website to obtain the current list of CVX codes to vaccine. The Labs information window contains the LOINC cross-reference utility page where test components from different labs can be mapped to standardized LOINC codes. In most cases, the test component is already mapped. If new tests are added to the in-house manual lab catalog, the tests that are being tracked by quality measures or in lab flow sheets or clinical decision support tools, i.e. health reminders, should have a LOINC mapping assigned. On this slide, I have provided a list of tests the UDS report qualifies. Please reach out to the HCN application support team if assistance on setup is needed. This concludes my presentation of the Intergy setup for the UDS reporting success. If you have any questions about UDS or anything that was shared in this presentation, please email the HCN UDS support team. The email address is provided on this slide. Thank you and have a great day.